In this vlog, we're going to talk about the concept of the central forelock, why it's important, and also some of the new thoughts about where the central forelock should be, sort of an expanded central forelock, if you will. Before we talk about the central forelock, let's establish the fact that when there is baldness or progressive hair loss in a male pattern distribution, we have to have enough donor hair to move the occipital hair and cover visually dense region of the scalp right here so that it frames the face and provides a nice rejuvenation overall. But we have a limited amount of donor hair to do the job. So especially in people that have limited donor hair or limited donor density or a wider area that's bald, we have to be able to use that amount of paint, so to speak, to paint the canvas effectively. If we take all the hair and put it equally distributed throughout, we're not going to quite get the same degree of visual density as we could if we effectively use a strategy to get a better result. So how do we do that? There are a lot of concepts like cascading and things of that nature that we've talked about and we will talk about in subsequent vlogs. But what we're going to do today is focus on one specific concept, the central forelock. What is it, and what are the current concepts of the central forelock? I don't know if you can see this drawing here, but in this drawing of a bald scalp, let's say we're going to have to fill this area in. And let's say it ends about right here, which would be the vertex or crown. So in this area right here, we need to fill in everything that's right here. The concept of the central forelock is if we fill the center area right here, right behind the hairline zone, maybe about a centimeter or two behind, that when people look at you from different angles, that this will provide visual density in all different directions. So this is the classic concept of the central forelock. But I think what's so important today is expanding that concept, because if you notice, someone looking at you this way still sees baldness. Now, of course, all of this is going to be filled in. We're just talking about increasing certain areas for more visual density. So what we do now is a central forelock should be considered to be back here as well. And because as you see, looking this way, you can't see bald in all directions coming through. So we can almost consider it like an oval in this area being the central forelock. And that's very, very important to create a higher area of central density so that the person seeing you from any angle from the side to side will not be able to see through it. Now, these two smaller subzones of the central forelock are different. What we do to create more visual density here is to make very tiny grafts very closely spaced together, and then we widen those distances as we go toward these regions right here. But in the back, we use those multifollicular unit grafts or combination grafts or slightly larger that create more visual punch, but would not look natural if we put it this far in the front. So it's using larger grafts that are a little bit more spacing to create more visual punch toward the center of the scalp in the posterior portion of the central forelock, and smaller grafts more highly packed together to create more visual punch. Now, if you said, well, which would you choose? If I had a choice between slightly larger grafts, say like 2 follicular units put together versus single follicular units more tightly packed, which would give you more visual punch? And actually, interesting enough, the multifollicular unit grafts in the central region that we use, not all the time, depending on the patient's caliber, curl, and color contrast, we talk about that in another video on this website, those attributes would make a distinction whether we would go with slightly larger grafts or slightly smaller grafts in the posterior central forelock. But remember that those grafts actually create more visual density that we can achieve in a single session. And that's why we use combination grafting in a majority of our patients that would benefit from it, and those that would not, for example, if they have very thick, dark hair and a lighter color scalp, in some Asians particularly, or some Caucasians, we'd be less inclined to do so. But that's just to give you an idea of how we can maximize visual density by strategically putting areas of high density and then slightly fanning that area over, because we have limited grafts that we have to create a visual illusion of hair density.